So I'm going to talk about how we introduce innovations in neurosurgery, and I guess it was very telling that my talk came after the previous one, because many times we are always, as neurosurgeons, um, we are always attracted by anything that gets a head start or gets published in high income countries. If somebody can say, okay, I have found this new thing that I think is going to be helpful, then everybody jumps on the bandwagon, and then we say, okay, let's try to make it affordable in low income and medium income countries. And many times there is a lack of an evaluation if this theoretical innovation is really helpful or is just a sort of a unhelpful innovation. I mean, that's the same thing that has happened in neurosurgery over and over. For example, we moved from the operating microscope to the endoscope, and there was really no evaluation or no evidence that the endoscope was going to be helpful, but then everybody jumped on that. And now the same thing is true with the exoscope, and we are coming sort of full circle. And it's very important to understand that many innovation in neurosurgery, they are not really driven by by what's best for the patient, but many times by what's best for the individual or what's best for the industry that manufactures these new gadgets that continuously get thrown to us. So it's very important to make sure that we take a look at ethics, how are innovations introduced in neurosurgery, and are they introduced in an ethical way? Because only if an innovation is introduced in an ethical way and there is some thought process behind it, that's something that may be really able to help our patients. And really, ethics is very difficult to define ethics. But as somebody said in a landmark case in the United States that was dealing with pornography in movies, a Supreme Court justice said, I don't know what's the definition of pornography, but I know it when I see it. And the movie in consideration he felt was not a pornographic movie, so they gave a go-ahead. So why are ethical consideration important in introducing innovation in neurosurgery? The main thing, thank you. The main thing is that they are important to protect the patient. Because neurosurgery, no matter what, no matter if you use a microscope, an endoscope, an exoscope, artificial intelligence, augmented reality, and what's not, is inherently a dangerous activity. There are always potential problems, significant problems, even when you place a burr hole for a subdural hematoma, or even when you introduce an intracranial pressure monitor. So one important consideration is that ethical innovation should be the answer to a clinical problem, not the answer to a profit-making motive by anybody. So the bigger the problem, the more meaningful is the solution. Now, there are considerations that are important in considering innovation. So what are the potential ethical threats to innovation? First of all, financial incentives. Financial incentives, because unfortunately in many countries, medicine is just a business. It's a profit-making business. So unless you make money, you cannot run any business. Then recognition incentives, because when somebody gets published and gets a lot of paper published, that's very important. Clearly, those threats are more important, more potential for dangers are associated with any innovation. For example, there are things that are very simple, that are really do not pose any significant threats, and there are things that are more dangerous. For example, we were involved we were very attracted by using the ultrasonic technology to drill the anterior clinoid process. And when we contacted the company, one of the company that was making this instrument, because we want to know what their answer was to those reports that many people woke up blind after drilling of the anterior clinoid process. And I asked them, so what is the temperature that is generated by using this ultrasonic aspirator to remove the anterior clinoid process? And they had no idea. They had no idea. And we did a study in our lab when I was in Columbus, Ohio, in which we looked at the heat that was generated by using the ultrasonic aspirator versus the conventional low-cost, really low-cost drill to drill the anterior clinoid process. And we found out that the temperature were significantly higher when you were using the ultrasonic aspirator. And I was completely flabbergasted and surprised by that. So that's just to tell you that you need to always be a little bit skeptical at the beginning and ask for proof, ask for, is this thing really going to be of benefit to the patient? Certainly the patient that got blind when the anterior clinoid process was drilled using the ultrasonic aspirator, they were not happy. And also many of the surgeons who did that, obviously, for obvious reason, they were not publicizing this issue. So how we introduce innovation in an ethical fashion? First of all, it's important, of course, to have, as everybody knows, to have informed consent and then to have an unbiased evaluation and attention to solid and robust peer review. In 2010, there was a group of scientists, philosophers, and healthcare individuals that got together in Cambridge, and they came up with a sort of recommendation that they call the ideal recommendations that should serve as a guideline to the introduction of innovations in surgery. First of all, there should be a phase one, the idea phase, when there is an answer to a cogent problem, clinical problem. Then there is the development phase, in which the planned use of the procedure is used in a small group of selected patients. And of course, the outcome should be registered not in the surgeon's institution, because everybody is biased, but should be registered outside the surgeon institution to make sure that there is fair evaluation. And then as this innovation, whatever it might be, it's a technical innovation, a procedural innovation, takes hold, then you go to explore in a larger group of patients, you doing some sort of prospective evaluation. And today it's not necessary to do the conventional, double-blind study. You can have a robust evaluation using simpler technique. And then the important thing is the assessment phase, in which you assess the impact of this proposed innovation on the clinical problem. And then most important is the long-term evaluation, because as we know, by the pharmaceutical industry, many times the adverse effect of drugs, they get only evident once they are used on a massive scale in a longitudinal fashion. And there are countless examples of drugs that were found to be safe in phase 1, phase 2, and phase 3, and then in phase 4 they were found to be very dangerous. One for all is the thalidomide that was used in the 70s to combat morning nausea in pregnant people, and that just in long-term evaluation was found to be associated with tremendous defects in the newborn. Of course there are several things that are self-evident. For example, nobody ever thought of doing of doing a study on the impact of tracheostomy for tracheal obstruction, because that's self-evident that it's a life-saving procedure. And I think my time is up, so that's what I want to say. I want to say that we must always be very cognizant of the potential threats that are embedded in any innovation that gets sent to us. And then we need to be able to evaluate them critically. And the most important thing is that we need to be able to make sure that this innovation is an answer to a clinical problem. I want to know if anybody tells me what is the clinical problem that pushed forward the introduction of exoscope. What is the clinical problem that exoscope are supposed to address? None. Thank you.